let's talk a little bit of strategy before we dive in, a little test-taking strategy. So people ask me, what is the best advice I can give to someone who's going to take the NCLEX? And I will tell you, my number one piece of advice that I give to everybody that I say is so important is to make sure that you read the header and the stem really, really carefully. And I know this sounds simple, but you would be surprised how easily this can trip people up, because the NCLEX might ask you something like, which of the following actions by the nurse is correct? Okay, so in that means we're looking for one correct answer, and three of those options are going to be incorrect, right? But then we might also get a stem that says, which of the following actions should the nurse take first? Well, that means that all of our answer options are going to be correct, but only one of them is going to be our highest priority that we should do first. And then we might get an even different stem that asks us which of the following actions by a staff member would cause the nurse to intervene, which means it's kind of asking us almost a negatively phrased question saying which of these actions is incorrect. So you can see that if we don't read that header and stem really carefully, we could accidentally answer that question wrong, even if we know the content, which is definitely not what we want to do. So always, always, always read very carefully before you answer the questions. And then when I'm going through questions, I like to read the header and the stem really carefully. And then I like to ask myself, okay, what do I already know about this topic? So for example, say that I got a question, a pharmacology question, and it was asking me about fluoxetine. Okay, what do we know about fluoxetine? You guys can help me out. So we know that fluoxetine is what kind of medication? It's an SSRI, right? A selective serotonin reuptake inhibitor, which is a mouthful. And so we know that these are used for depression and anxiety. Can anyone tell me what are some common side effects of SSRIs? I know GI upset, right? They can cause like nausea, diarrhea, headaches are common. Sexual side effects are really common with this class. What do we know about how long these take to work? They can take several weeks to start working, right? And then what's the big thing we worry about with this medication class? Serotonin syndrome. And I always remember the symptoms of this in kind of a fun way. I always think of sweating, shaking, and strange behavior. So like sweating or fever, shaking or muscle rigidity, and strange behavior, so like changes in mental status, right? Okay, so already we can see we know quite a bit about fluoxetine. So that kind of helps me. I do my brain dump, and that can be really quick, just to kind of a quick run through. And so if I got an answer option that said, oh, the client needs to avoid aged cheeses and wine or tyramine containing foods, I would say, oh, well, that is true, but it's true for MAOIs, right? Not SSRIs. And so by doing this brain dump, it just kind of helps me to put down everything I know so that I'm not accidentally distracted by like a distractor option that might be true of like a different class of medication. So it kind of helps me keep things straight in my head. Okay, so once I do that, then I start ruling out answer options, okay?